Attention Deficit Hyperactivity Disorder, or ADHD, is a frustrating and misunderstood condition that inhibits a person's ability to focus. Often diagnosed in children, the National Institute of Mental Health estimates 3% to 5% of kids have ADHD. But some experts believe that figure could actually be as high as 10%. ADHD used to be known as ADD, Attention Deficit Disorder. It was renamed ADHD in 1994. It is sometimes still called ADD to describe a type of ADHD that does not involve hyperactivity. Simple everyday tasks can be extremely hard for someone with ADHD.
It affects various areas of functioning, including school, occupation, playing with friends, and a lot of other areas like kind of trying to do floor planning and executive functioning. ADHD kids, depending on the severity of their problems, they are able to do some tasks. They're able to focus on their homework up to a certain point, after which they start getting distracted very easily, they don't want to come back, or sometimes they get overwhelmed. The same thing goes for other tasks that need sustained attention. It could be trying to sit down at a dinner table and eating a meal together with the family. That can be extremely hard for them. Or it's actually sitting down and playing a board game with a family member. It's something that an ADHD kid cannot do on a sustained basis. He might be able to play for the first 10 minutes or 15 minutes, but after that he has to find something else to play.
There are several symptoms to watch for if you think you or someone you love might have ADHD. The main symptom of ADHD is the inability to pay attention, which often leads to poor academic performance. For example, listening to a teacher, following directions, finishing tasks, or keeping track of personal items are all difficult for someone with ADHD. Another symptom of ADHD is the inability to sit still. Children may run and climb on things constantly, as well as squirm and fidget when trying to stay seated. Some kids with ADHD talk excessively. The third symptom is impulsiveness, cutting in line, interrupting others, or blurting out answers to teachers' questions. This aspect of ADHD makes it difficult for children to think before they act, which in turn affects social development. They may have low self-esteem because they have trouble making and keeping friends. ADHD also increases the risk of childhood depression and anxiety disorders.
The neurotransmitters that are affected in ADHD are also some of the neurotransmitters that are also affected in depression and anxiety, which is mostly serotonin and adrenaline. There are neurotransmitter regulation that happen inside the brain that we still don't know much about. But there is a close correlation about how these affect each other, and that can eventually cause depression and anxiety. Not only that, if you look at the impairment in functioning for these ADHD individuals, whether it's a child or an adult, they're constantly trying hard to succeed. They're constantly trying to be as close to normal as some of the other peers are, but they keep failing. So most of the kids who are diagnosed with ADHD eventually do end up developing anxiety disorders or depression.
Because ADHD runs in families, many experts believe genetics play a role. However, the cause of ADHD is still unclear.
We believe that there's probably more than one factor contributing to this, and we look at different factors even when we are trying to evaluate or diagnose somebody with ADHD. And one of the most common reasons we look at is genetics, actually. The heritability factor in ADHD is up to 70%. We know a lot about ADHD at this point, but there's a lot more we don't know yet. There are also other studies that are looking at metabolism. How does the brain work, and what are the differences of dopamine regulation and adrenaline regulation between a normal brain and an ADHD brain?
Since there are no lab tests to detect ADHD, doctors rely on the patient's responses to questions, the family's description of behavior problems, and a school assessment. With ADHD, a child must display some combination of inattention, hyperactivity, and impulsivity for at least 6 months. Some of the symptoms need to have appeared before age 7. Medications and counseling can help increase a child's attention span while controlling hyperactivity and impulsive behavior. Studies suggest drugs work in 70% to 80% of patients, although they have some troubling side effects.
The main side effects you can expect from stimulants are there's definitely appetite suppression. These kids don't want to eat once the stimulant is in the system. Definitely there are some difficulties with sleep. These kids have a hard time falling asleep. Although I have to add that, especially in kids with hyperactive impulsive type of ADHD, there have been a few cases where the stimulant actually calms them down enough that they actually sleep better on the stimulant rather than without the stimulant. And there are also few other side effects. If they're not eating well enough, there are concerns that they might be losing weight. And and there are some rare side effects that are noticed, especially with respect to chest pains or cardiac side effects like increased heart rate or one of those kind of symptoms. And very, very rarely could you have seizures from overdosing on this medication.
Counseling can help a child with ADHD learn to develop coping skills and build self-esteem. It can also teach parents how to be supportive. Parents can give kids structure and order by posting a daily schedule of reminders so that their child knows what they are supposed to be doing at any given time. This is a huge help to someone with ADHD to stay on task. The schedule should include specific times for waking up, eating, playing, homework, chores, and bedtime. Studies on ADHD diets are inconclusive, but many health experts believe high-protein foods, including eggs, meat, beans, and nuts, may improve concentration. It's also helpful to replace simple carbs like candy and white bread with complex carbs like pears and whole grain bread. As for junk food, there is no evidence that sugar is a cause of ADHD, but some parents believe preservatives and food colorings worsen the symptoms.
Unfortunately, as many people would like to believe, ADHD does not resolve as the children grow. It does not, children do not grow out of it. It is estimated that anywhere from 30 to 50% of children who've been diagnosed with ADHD continue to have problems even as adults. It's just that the adults develop different coping mechanisms or do not want to seek treatment. It doesn't mean that it's not there.
Many people living with ADHD learn to focus their attention, develop personal strengths, minimize disruptive behavior, and in turn can lead a productive and successful life.